Mm. Hello, everyone. Welcome to the Bouvet College of Health Sciences. Thank you so much for being here with us today. We wish we could be hosting you all on campus in person, but we're really happy that you're still taking the time out of your day to meet with us virtually. So we'll take you on a little tour of the Northeastern University Bouvet College of Health Sciences School of Pharmacy, tell you what we think makes us a strong program, and hopefully you'll learn about some opportunities we can offer you in your future career as a pharmacist.
Hi, everybody. My name is Michael Conley. I'm an associate clinical professor here at the School of Pharmacy. I've been at Northeastern for almost 10 years now. One of my fun facts that I like to tell everybody during our live interview days is that I started off as a direct entry student within Northeastern. So I was part of the first class to be a direct entry student. So I can speak to kind of how it is to go to school at Northeastern in the city, get a PharmD, as well as some of the great aspects that and how the program has evolved over the years. I have a practice site at the Community Health Center in Dorchester, Mass. I'm what you call an ambulatory care pharmacist. So I work with a lot of patients in the neighborhood to do direct patient care with their providers. We help manage chronic disease states like diabetes and hypertension. It's a really great opportunity for pharmacists. Taylor, would you like to introduce yourself?
Sure, thank you. So hi, everybody. My name is Taylor Rose. I'm an assistant clinical professor here at Northeastern, and I've been here about 6 years now. I am also an ambulatory care pharmacist with a practice site in Lynn, Massachusetts, doing chronic disease state management, mainly of patients with diabetes and hypertension in that community. And Dr. Conley and I have been co-chairing our admissions committee for several years now, so hopefully we're able to share relevant information to you that will help you make the decision as to whether this is the right place for you. And we hope that you will find that it is.
Yeah, the major purpose of our presentation is just trying to hit the highlights of what makes Northeastern Northeastern and kind of separates us from other schools of pharmacy around the country.
Absolutely. So we'll try to cover those main points today. I'm sure you will all have questions, and please feel free to send them along to our PharmD admissions email address, and whoever the correct person to best answer that question is will get back to you. During the interview day, you will also have an opportunity to meet virtually with several of our faculty members as well as current students. So that'll be another chance for you to get some of those questions answered that we don't cover today.
Yeah, definitely. Those roundtables are going to offer you a great opportunity to ask students and faculty questions you have about the university and about the program. And after participating in those roundtables, if you do have anything, please don't hesitate to reach out to us.
Absolutely. Okay, so at Northeastern, our Doctor of Pharmacy program, there are two different pathways to enter the program. And so historically, the majority of our students have come through our early assurance pathway, where they come straight out of high school, complete 2 years of pre-pharmacy studies, and provided that they meet a certain set of expectations, they progress into our PharmD program. So Mike mentioned several years ago, he was the first cohort of direct entry students, and we've really ramped that program up over the past 5 to 6 years, to the point that now about a third of our class is coming through what we call our direct entry program. And those would be folks such as yourself who already have a bachelor's degree and have met the prerequisite studies for pharmacy school and are going to enter directly into the P1 or first professional year of the program. And so you'll hear in the world of pharmacy, there are tons of acronyms and abbreviations, and we will try to define those all the best we can for you. But when we refer to direct entry, that's what we're speaking of.
So back when we started this one, for myself being the first DE, one of the first DE programs, there were 10 to 15 of us that started the program. And our numbers were quite small for the first couple of years. But recently, over the last 3 or 4, our DE program, the number of students entering that way has become much greater. Like Dr. Rose said, it's about a third of the class. So when you do come into that first professional year, you're entering into you're going to be joining a class size that's probably around 60 to 70 students. So we're shooting for like an overall class size for that first professional year of about 100 students.
Okay. So taking a look at the prerequisites here, hopefully you are familiar with these already, but if any of you do have outstanding questions, Christina, our admissions coordinator, is going to be your best point of contact, and you can reach her at that PharmD admissions email address. And so you will have some time to speak with her during the interview day, but also feel free to reach out to her before then if there's anything you want to be clarified.
So this is an example of a sample of our curriculum, and as you can see, it's pretty lockstep. In order to go from one year to the next, you need to pass each class with a B. We're looking for students to maintain an overall GPA of 3.0, and a passing grade in each of these required classes is C or better. As you notice, your first professional year, the P1 year, you're going to come in September, and you're going to start learning about pharmacology and medicinal chemistry. You're going to learn about all the different drugs and how they work, the side effects. Then once you get into that second professional year, that's where we get into our comprehensive disease state management classes. Our CDM classes, as we like to call it, are also what might be known as like your therapeutics classes in other universities. But this is where you get into really the meat and potatoes of pharmacy. You're learning about the drugs, all the disease states, all the drugs used to treat those disease states, and all the evidence-based guidelines that tell you what medications to use when treating those disease states. So you're really getting into the content that really going to enable you to practice pharmacy. Students, they really like this class. They're really intimidated by this class, but it's really, it's an exciting intimidation because you're gaining the knowledge to really provide that direct patient care. As you progress into the third professional year, one of the courses I'd like to point out is our economic evaluation class. Historically, when I was a student, that class was tied to our capstone project. So all students at Northeastern are required to complete a capstone. And what a capstone is it's essentially a one semester research intensive project, where by the end of the semester, you create a deliverable, whether that be a poster presentation that you can present at a national meeting, or a research article that you can publish in one of the journals. Myself and Dr. Rose have worked with a lot of students at our clinical site to do capstone courses, and I've had students present in Chicago, in Las Vegas, out in California, Seattle for national meetings. So the capstone, it used to be tied to the economic evaluation class. And I don't know about you guys, but doing a cost benefit analysis and that kind of research, not all students were really engaged and interested in doing that kind of economic evaluation, economic research-based projects. So what we've done is we've decoupled the capstone project from our economic evaluation class, and it allows you to do research projects with any faculty within the School of Pharmacy based on what your interests are. So if your interests are more patient care, diabetes management, medication adherence, you might want to reach out to Dr. Rose or myself or some of our colleagues who are doing a lot of that kind of research at our practice site. So it's a really great opportunity for students to start to build that. During this presentation, you're going to hear us talk about like how Northeastern is going to set you apart from others. And one of those is this capstone project, where you're going to have at the end of the project either a national poster presentation or maybe even a manuscript, which, when you guys start thinking about, graduating from pharmacy school and getting a job, like having these kinds of things on your resume is really going to help set you apart from others. So it's a really great opportunity. So Taylor, do you have anything to add about the capstone or CDM?
So I think just a couple of common questions that we normally get when we're talking to applicants about this sample curriculum is, one, it looks pretty credit heavy, and it is. So one thing to note about Northeastern that is a bit different than other institutions is that we do operate on a trimester system. So there is spring, summer, and fall semesters. So there are several week breaks in between semesters, but you are going to be going year round. This is not like other universities where the summers are going to be off. And we'll talk a little bit about why that is when we discuss our experiential education momentarily. So the last year of pharmacy school, it's your P4 year.
You are not in classroom, you're doing your clinical rotations. Here at Northeastern, we do six-week rotations out of a 7-rotation block. So there will be a 6-week point in time where you'll have minimal to nothing to do. We have 4 required rotations. One is in ambulatory care, like Dr. Rose and myself. Another is internal medicine. There's a community rotation that's required, and another direct patient care rotation, whether that be cardiology, infectious disease, oncology, something where you're working directly with patients and making recommendations. The last 2 are electives, and you can choose to do anything you want. Northeastern offers a ton of different AFI experiences, from leadership to industry. If you want to work, if you're interested in drug discovery and drug delivery, working for a drug company, teaching, education, there, as well as national AFIs working for the FDA or the DEA. So you'll have really, we hope you come here, but if you don't, one of my biggest recommendations is that when you get to that 4th professional year is you really diversify your AFI experiences and trying to pick something that you think you might be interested in, to help you figure out what you want to do when you become a pharmacist.
Yeah, and I think that's one of the hardest things about being a pharmacist is there are so many different opportunities, and having to choose between them, it can be difficult. Too many good options. But as your APPIs will certainly be a great opportunity to explore that, as well as our professional electives that happen mostly within the 3rd professional year of the program. And that's another big area we've been focusing on, is trying to broaden the scope of the professional electives that we offer. So if you think you might be interested in geriatrics or ambulatory care or internal medicine or over-the-counter and self-care for folks who are looking to go into community pharmacy or industry pharmacy, we bring in folks from the pharmaceutical industry companies in Boston and Cambridge, one of the surrounding areas that's really blooming with industry companies right now. There are a lot of different ways to explore and to help you find out what you like, and just as importantly, what you don't like. So again, diversifying those experiences through your electives as well as your experiential education is really beneficial. Okay, so moving along to talk a bit about experiential education, and this is what we think to be one of the major strengths of our program. In any school of pharmacy, you are going to participate in 2 different types of experiential education. There is the introductory pharmacy practice experience, which is sometimes known as IPPE or IPPE, and then the advanced pharmacy practice experience, or APPE or APPE. And at any school, as Dr. Conley just mentioned, the APPE experiences are going to take place during the final year of the PharmD program. And they might differ slightly in terms of how many opportunities you have, or how long each opportunity lasts. But by and large, APPE year is going to be similar at many institutions. What really sets us apart is our introductory pharmacy practice experiences. These are going to take place during the first 3 professional years of the program. And at many institutions, these consist of shadowing opportunities. So I can tell you from my personal experience during my IPPEs, I had to spend 100 hours in a community setting, 100 hours in a hospital setting, and 100 hours sort of split between other different pharmacy settings. And I was just kind of shadowing around, following the pharmacist, hoping to glean as much as I could from kind of watching over their shoulder. But I didn't have a lot of hands-on experience. I didn't have a lot of accountability or opportunity in those areas. And because of that, made it a little bit difficult to really get a feel for if that type of career path was going to be a good fit for me or not. So one of the things you've probably heard about associated with Northeastern is our co-op program. And one thing I just want to clarify is that here at Northeastern, when we talk about co-op, co-op is synonymous with IPPE. So when you complete your co-op, those hours are going to count as your IPPE hours. And I will turn it over to Mike to let him tell you a little bit more about exactly what co-op is.
So co-op is probably what Northeastern is best known for, and we've been doing it for a really long time, and we're really good at it. When you come in your first P1 year, during that first fall semester, you're going to work with our designated co-op faculty who are going to help you identify what jobs are available for you to do a co-op in. they have a whole list of jobs for hospital and community pharmacy, with slight differences between each one of them that you can choose from. So they're going to work with you on developing your resume, applying for these jobs. Once you apply for the jobs, these employers are going to offer you an interview. You have to go and interview for this job, and then you have to be offered, have to receive a job offer. So it's not uncommon for many of our students to have multiple interviews and receive multiple job offers. So our co-op is really bridging that academic, didactic and experiential education. So you're learning about pharmacology and drug delivery in that fall semester. Then you're taking what you learned in the classroom, and the following semester you're going to be on your first co-op, and you're learning about the drugs, and you're seeing the drugs, and you're able to fill these medications for patients and see what patients are taking and how they're taking it. Then you're able to take all that information that you learned on your co-op, that you learned during your job, and bring that back to the classroom experience. So it really, one is reinforcing the other, and it's a really great model that we have. So these jobs that you're going to get, they are full-time jobs. So when you're on co-op, it's a 40-hour-a-week job, where you're generally doing the job of a pharmacy technician. One of the great things about this experience is that you're going to get paid to do your job, which I'm sure all of you like to get paid when you work. Unlike other schools of pharmacy, when students complete their IPI hours, they're not getting paid to complete those hours. So here at Northeastern, like Dr. Rose said, our co-op is our IPI experience. So students are getting paid to do those IPI hours and accrue those IPI hours. It is in terms of helping you, like setting you apart from other students who are graduating across the country with a PharmD, having this co-op experience is really valuable. When you go and you're looking for a job, employers want to see, maybe they don't care as much about what your GPA is, but they care about how do you function on the job. Can you handle the pressure of the job? Can you show up on time? So having had this real life work experience, so co-op is 4 months of work experience for these companies. You're able to develop relationships with these companies, have these relationships, write you letters of recommendation when you're looking for postgraduate work. So it really does help set you apart and set you up for the next step in your career.
Yeah, absolutely. And I think, to reiterate the key point there, is just we are the only school in the country that you're going to get paid to do your IPI hours. So that is a huge advantage. Another advantage to this is because it is a part-time job, you're going to be spending, or it's a full-time job during the co-op timeframe. You're going to be spending 40 hours a week working for whichever institutions that you choose to complete your co-op at. They are investing a lot in you in terms of training and in terms of having you become part of the team. So many of our students will stay on and work part-time even after co-op is over. When they go back to class, they'll work, an evening or two a week, or maybe on the weekend, maintain those relationships, maintain that income stream, and kind of keep building their professional network. And so when you're an employee, you have to be there on time. You are accountable. The institutions in the Boston area, because we work on the trimester system, one of our classes is out on co-op all year long. So they have dedicated co-op jobs that they are counting on a Northeastern student to fill to make their pharmacy department run smoothly. And so they're really going to rely on you. And when it comes time to write that letter of recommendation, they're going to be able to speak to who you are as an individual and also as an employee, and what you can bring to an institution as a member of the workforce, as a team member. And so we consistently hear from our stakeholders, folks who are hiring our graduates into either postgraduate opportunities or just jobs of any sort, that our graduates are much more polished, much more prepared, much more workforce ready than graduates from other programs. And we think that there is a direct line between our co-op program and those outcomes.
So I'd just like to highlight one other point about the co-op. Our direct entry students complete 2 co-op experiences. Our early assurance students, because they've been here longer, have a 3rd co-op experience. The DE experience, because of accreditation, one co-op has to be done in an institution like a hospital setting, and another co-op has to be done at a community setting like a CVS or a Walgreens.
Okay, so where can you complete your co-op? And the answer is pretty much anywhere you want. excuse me, you'll notice that Northeastern University does not have a medical school affiliated with it. And some people might feel that maybe that is a weakness of the program because you're looking for an academic medical center, but we would challenge that, in fact, it is one of our strengths. Because if you take a look at this map here, within a stone's throw of Northeastern, we have many of the absolute best hospitals in the country, if not the world, in terms of Mass General Hospital, Tufts Medical Center, Boston Medical Center, Boston Children's, Brigham and Women's, Beth Israel, Dana-Farber. These are places where every practitioner is practicing at the absolute top of their license and the top of their profession. And so having the opportunity to work with these individuals throughout your co-ops as well as your APPEs is truly incredible, and really makes for a great learning experience, and one that you just really can't get anywhere else.
Yeah, just I can't speak highly enough about the hospitals just down the street from us. I mean, they're the hotbed of medical research, and physicians and pharmacists are practicing at the top of their license. I mean, you'll get to work with medical students from BU and Harvard and Tufts. So it's a really great learning environment. Dr. Rose has a great story about when she was an APPE student practicing at one of these Boston hospitals, and who she was on rounds with.
I was at Brigham and Women's, and at the time, the JNC7 shouldn't date myself here. Hypertension guidelines had just come out, and the night before, I had been preparing, reviewing the guidelines, making sure I was ready to make recommendations for the patients on this cardiology floor. And I get to the floor and look at the name of the attending physician, and it was the lead author on the guidelines. I had just spent the night studying. So it's pretty incredible, the folks that you get to work with. And I think by having the opportunity to work with all of these institutions rather than just one, it really is a huge, huge benefit for our students.
Totally agree.
For those of you who have never been to Boston, it's an awesome city. I wish you all got to be here to see it, especially in the springtime. It's a beautiful place. It's a relatively small city, so if you're used to New York or LA, Boston is small. You can walk across the whole thing in 45 minutes or a half an hour if you walk at the speed of Dr. Conley. And we are located right on two of the public transit lines. We call our subway lines the T in Boston. And so we have two of those lines right on campus. So you can really get around the city very easily and quickly. And in addition to all of the medical centers and pharmaceutical industry companies that are located in the area, it's also just a great place to be from a cultural perspective. There's awesome food. There's within 2 blocks of our building, the School of Pharmacy building, we have the Museum of Fine Arts, we have Symphony Hall, the Isabella Stewart Gardner Museum. So there is just, no matter what your interests are, I should mention Fenway Park is about a 10-minute walk away. So there's a lot going on at all times, and it's just a really great place to be. And we would encourage you to study hard, but also to kind of get out and enjoy the city and make sure that pharmacy is not taking over your whole life, that you still take some time to enjoy yourselves and keep your mental health intact as well.
So for those of you who haven't been to Northeastern yet, its campus is centrally located in the city. And compared to other universities within the city, it does have a really good physical footprint campus feel to it. I know I was an undergraduate at University of New Hampshire, and that definitely had a campus feel to it. But Northeastern does too, and its central location makes walking to all the hospitals, to all the cultural events really easy. As well as if you want to live in and around the city, there's lots of different neighborhoods you can live in, depending on how much you want to spend. You can even live off campus. In some of the suburbs, and the commuter rail, there's a commuter rail stop, one of the light rail systems stops right on campus. So you can really do anything. It's a great place to go to school.
Absolutely. All right.
So Northeastern prides itself on research. We're a tier 1, level 1 research institution. We are number 1 among private institutions in terms of NIH funding. So federal grant funding, our researchers at Northeastern are really good at acquiring. Some of our scientists, they're at the top of their field in terms of drug delivery and drug discovery, some of our bench researchers. But most, if not all of your clinical faculty are also working on clinical-based research. So, as the scientists on the bench develop the drugs, how do these drugs work, and how do how do we get patients to take these drugs? What happens to patients after they start taking these drugs? And that's where Dr. Rose and I can kind of do some of our research in kind of the clinic setting.
And
As part of,
go ahead.
sorry, as part of the, that capstone project that we talked about earlier, we really encourage students to reach out to faculty who share that you share similar research interests with. And to help you do that, one of our student groups puts together a compendium of all the different faculty and all the different research projects they're involved in. So you can kind of flip through this and get an idea of what each faculty member is doing and see if your interests align with anybody in particular.
Yeah, so applicants will often ask us, I'm really interested in research. How do I get involved? When can I get involved? And the capstone project is definitely an opportunity that will make everybody get involved in some type of research just to gain that experience. But if you are interested, basically, as soon as you come into the program, you can take a look through the compendium and it will list if faculty are interested in taking on students from the first professional years of the program, either as directed study students or as kind of volunteers. So you can seek out some of those opportunities as well. And we do have several APPE electives that will allow you to kind of deepen your research experience. So everybody will get involved a little bit. And if you want to get involved a lot, there are certainly opportunities for you to do that throughout the PharmD program.
Definitely.
So, we just wanted to talk a little bit about the facilities, which again, I wish you could see, and I hope you all have an opportunity soon to come and visit campus and see this in real life. But we do have some state-of-the-art classrooms and laboratories. That big glass building they're showing you is our Baracus Health Sciences Center, which was donated by one of our School of Pharmacy alumni. That's where many of our pharmacy classes and labs take place. And to give an example of some of the types of facilities we have available there, we have a simulation laboratory. And within that simulation laboratory, there are several setups to look like a hospital bay. And so in that, there'll be a hospital bed and there's a patient in the bed, and the patient is a mannequin, but it is not your average mannequin. It is a mannequin who has a blood pressure, it has a pulse, it can breathe, it can speak, which is really an instructor speaking to you from behind a two-way mirror, which is a little bit Wizard of Oz like, but we will pair up our students in interdisciplinary teams with some of the other health profession students, including nurses, physical therapists, nurse practitioners, nurse anesthetists, physician assistant, speech language, audiology, and pathology.
Pretty good.
Probably forgetting one, but we do have many different programs within our system, and we'll pair up students with folks from the other professions and run you through a simulation. So you don't know what you're walking into, but here's this patient that you need to care for, and everybody needs to figure out, how are we going to manage this? What is my role, my profession's role in the care of this patient? And how do we work together to achieve the best outcomes? And so this is a really cool opportunity for you to learn prior to when you get out into the real world and are dealing with a real patient, how to make that all work in practice. And so, you can kill the mannequin and we can bring it back to life. So getting those mistakes out of the way before getting out into real patient care is a pretty awesome opportunity.
Yeah. So Dr. Rose mentioned like all the different health profession programs that Northeastern offers. And part of the university's push a couple of years ago was to take more of an interprofessional, interdisciplinary approach to healthcare. So being able to participate in these simulations, not only do you kind of learn, practice what your job is on the healthcare team, but you learn how other health professions fit into the patient care continuum. So, what is the role of the speech, audiology, and pathology person? What is the role of the nurse practitioner versus the nurse versus the physician assistant? So it really gets you, it allows you to have that experience early on so that when you do get out into the world and provide direct patient care to actual patients, you have a better sense of how each team member fits into providing really good patient care.
And one of the initiatives going on within the Bouvet College right now is trying to take that, not just from experiential learning, but also integrate interdisciplinary learning earlier and earlier into our didactic teaching. So, nurses need to learn about how to care for patients with diabetes. So do pharmacists. So why can't we do that together and learn from the get-go how we can all work together to provide the best care for our patient? And so that's something that we're striving towards, to get those opportunities to be frequent and to start earlier in the program. And I think during the time that you're with us, you'll see that. In terms of our faculty, we have many clinical faculty, you're speaking to two of them now, who are out and practicing. So Dr. Conley and I each spend at least 3 days per week at our clinical practice sites where we're providing care for our patients. And so we're able to, kind of see what's happening in the real world and bring those real world experiences into the classroom so that you're getting the most up-to-date information. And we have faculty practicing at all of those major institutions that we just talked about. And so again, really staying on the cutting edge of what's happening in medicine.
So we definitely want to provide a lot of support to students. Direct entry students coming to Northeastern have a couple of different advisors. So through the Bouvet Office of Student Services, there's a graduate student office. There's also an undergraduate student office. And because our program, the pharmacy program, is a mix of direct entry and early assurance students, you'll have you'll be able to use both of them as a resource. Also, when you come into the program, you'll be paired with a portfolio advisor. So our portfolio process is, it's kind of a way to help students reflect on what they're doing, where they're going, what they want to do, what they think they want to do when they graduate. So you're meeting once a semester with a faculty member that you're paired up with to kind of discuss, what did you do on co-ops? How's the semester going? What do you think you might want to do when as a pharmacist? Dr. Rose mentioned the hundreds of different jobs that you could have as a pharmacist. So you meet about once a semester with the faculty member, and each semester you're working on your portfolio. And to complete your portfolio, a lot of times we're asking you to go and listen or talk to other members of the pharmacy community to learn about what they're doing. So a lot of the time our student groups will bring presenters in, and as part of the portfolio process, you have to attend 3 of these presentations. And it's a really great opportunity to kind of listen to what other pharmacists are doing in other different disciplines. And I find that it's more important to find out what you don't like as is to find out what you really do like. So being able to touch base with your portfolio advisor and kind of reflect on what you're doing is a great asset. Like I mentioned, the pharmacy student government organizations here at Northeastern, we have, Taylor, correct me if I'm wrong, is it 13 different pharmacy organizations?
I believe that is the most up-to-date number.
Okay, so again, we encourage all students to come to Northeastern to take an active role in 1 or 2 of these organizations. And we mean active by taking on a leadership role or really trying to be involved to help build their resume.
Okay, so hopefully we just ran through some of the things that we think really make Bouvet stand out and why we think our School of Pharmacy is unique amongst the rest in the country. So our experiential education, in particular that co-op program, having the ability to complete your clinical education at some of these leading healthcare facilities, our interprofessional approach to education throughout the college, the incredible research that's happening right here at Northeastern University, and of course, just being in the city of Boston itself. And to put our money where our mouth is a little bit, we think that these are our strengths, but that also bears out in terms of statistics. And so ultimately, we know that you are looking to start your career, and you want to make sure that when you graduate from pharmacy school, you are able to have the career that you're dreaming of right now. And so to that end, we have the #1 ranked career services program. So making sure that our graduates get to where they want to be, we have really strong resources to support that. Over 90% of our students are employed, go on to postgraduate training or graduate school. I believe this is within 6 months of graduation. So again, most of our students are getting to right where they want to be quickly upon graduation because they are so well prepared for the workforce. Our NAPLEX, this is our first time board pass rate in 2019. So 91% of our students are, that NAPLEX exam is the National Pharmacy Licensing Exam that every PharmD graduate will need to take in order to get their registered pharmacist to become a licensed and practicing pharmacist. And so 9 out of 10 of our students are passing that the first time around. And another,
nationally, isn't that rate nationally about 89%?
I believe that is correct, yes.
So we're, historically, Northeastern's always been above the national average in terms of first-time test takers passing the NAPLEX. So we're really proud of that.
Yep. Many applicants will ask us about postgraduate residencies and fellowships. If you're not thinking about this yet, don't worry. You don't really need to be at this stage. But if you are, and we're finding that more applicants are in recent years than in the past, if you're interested in going on to pursue a clinical pharmacy position, working as a specialist, such as ourselves in ambulatory care or cardiology, geriatrics, infectious disease, pediatrics, pick your favorite practice area. In order to get there, you're going to need to complete either 1 or 2 years of a postgraduate residency, which is where you're a licensed pharmacist, but you're working under close supervision of an experienced preceptor to gain the extensive clinical knowledge that you need in the specialty area really quickly. Fellowships are more research-based, as well as for jobs within the pharmaceutical industry, and these are typically a 2-year fellowship position after graduation. So these are highly coveted positions because they are sort of help you to fast track your career advancement. And to that end, they are very, very competitive. So we have lots of PharmD grads across the country all competing for these spots. And so in 2018, which is the most recent data we have available, we had 51 of our students placed into residencies and fellowships. So these highly competitive positions. And our class size at that time was around 130 students. So well over a third of our class was able to achieve those really competitive positions. So that's something that we're really proud of as well.
So I would just love to thank all of you for taking the time, to listening to this presentation, for your continued interest in this program. I know how hard it is not being able to get to campus. I would love to host everyone on campus so they could see how beautiful the campus is and see our smiling faces as we give this presentation as we like to do. But we're making the best of the circumstances that we have now. So again, thanks for listening to our presentation. Hopefully we've given you a pretty broad overview of the program, but answered any questions that you've got already. If not, please join in on those roundtable discussions during the day of the interview, and definitely ask other faculty, other students, any clarifying questions that you have.
Yeah.
Hopefully, once the social distancing practices start to ease, y'all can come visit the campus. But I guess in the meantime, continue to practice those good hand washing.
Yes, absolutely. So just to echo Dr. Conley's statements, thank you all so much for taking the time to listen to this presentation today. We hope that you learned something valuable and that you gained an idea of why we are so passionate about our program and why we think it would be a great fit for all of you. So again, if you have questions, hopefully you'll get them answered on that interview day. But if there's anything that we didn't mention that you are just dying to know about right now, reach out to that PharmD admissions email address, or you can find both of us on the website as well. Dr. Conley is just m.conley@northeastern.edu. I'm t.rose@northeastern.edu, and we would be happy to answer any questions. And if it's something that we personally can't answer, to direct you to the correct resource so that you have all of the information that you need to make the best decision for you. So thank you. Stay well, be healthy, and hopefully we'll get to speak with you all soon. Take care.